how did you present even when you're feeling good? How is your body functioning? How is it working? If certain starts to come up, can you have an intervention to help get that under control, to move the trajectory in the right position?
I think the craziest thing is seeing how some of these models can predict disease and issues months to even years before they happen.
Yes.
And that's going to be where I think a lot of people truly will be using this for themselves. Is
you're going to soon find out, and the more data you're collecting is going to have so much better implications in 10, 20, 30 years from
beautiful.
now.
Information is power right now.
Yes.
For example, this is a Stanford study. It showed deep molecular tracking of individuals long term. And they tracked genomics, proteomics, metabolomics, microbiome. And what they ended up finding was that I can assure you, if you're not listening now, that hopefully your ears just perked up, because welcome back, everyone, to the Functional Code. We are excited to bring to you guys today a new episode. We're going to be talking today about digital twins. This is an episode in our AI series. We're going to be talking about how AI can predict disease before you even feel symptoms using digital twin. As always, I am Dr. Addy.
And I am Dr. Jace. Can you imagine another one of yourselves, but just in a computer AI format? This is essentially what this digital twin is. It's essentially a twin of yourself on your genetics and all the other systems that run your body, but in a digital form. So essentially what we're looking at is, can we run certain equations to see what your digital twin that matches yourself can undergo to thus help you in real life? And that's just a snapshot of what we're going to talk about today, related to AI and where this field is progressing. I know when we had Micah on, he opened our eyes up, or at least my eyes,
for sure,
the trajectory where healthcare is going. And this, it may scare you, it blew our minds.
It did.
So for more in-depth context related to the actual processes and whatnot of digital twin, revert back to that episode. But in terms of how you can start bettering your health long-term, this episode is for you.
100%. And I think most people, when they hear the digital twin, they try to put in contemplation of what that actually feels like and looks like. And so it's really just a collected sample of all of the health data that we can probably gain on a person. And using AI algorithm, it then keeps track of those. And eventually there will be live time tracking of a lot of these systems too. And when they've been able to feed this information into the AI intelligence systems, it can track and predict things way more effectively, accurately, and quickly than a doctor can. And that's really where we need to start laying into as a healthcare provider, and really understand that there are just things that AI can keep track of and run real time that our brains just can't do. And it's okay, but it's helpful information.
Yes.
And we're going to go through here and give you some scenarios of how this is going to be impacting for your health long term. What are ways that maybe you can get into tracking this yourself right away before all this software starts to get built? And it may take some time to get built, but I'm super excited to start using my own digital twin to run scenarios on. And that's the other part, is there are scenarios where they can run in real time thousands and thousands of different supplements, modalities, treatments, all these things against your digital twin, and it'll tell you what the best outcome possible would be, what you should consume, take, do. And that's the efficiency part, where we can start as providers really understand where we can push patients in which direction for them using their own data. And I think that's where healthcare is about to go.
And with all this data being accessible to the public instead of just relying on the knowledge of physicians and their memory and their database, it opens up the ballpark and ballgame significantly.
Absolutely.
So this is something for y'all to think about, and I like this analogy. It almost summarizes what Doc just spoke on in terms of a snapshot, like a photo of how the person comes in. So say, for example, you're going to a clinic, you might be feeling sick, they're going to look at you then and there to treat the symptoms that time, currently then. Now, what are the symptoms or that cause that person to get sick? And also, after just treating that symptom, where is that person long term? Is it just out of the scope, out of the mind of that physician? If so, that's where the digital twin will look at it as a movie, as an ongoing reel of how did you present even when you're feeling good? How is your body functioning? How is it working? If certain starts to come up, can you have an intervention to help get that under control, to move the trajectory in the right position, thus the better help your health long term to the future. So we're looking at the gap, not only small, but also past and future instead of present.
I think the craziest thing is seeing how some of these models can predict disease and issues months to even years before they happen.
Yes.
And that's going to be where I think a lot of people truly will be using this for themselves, is tracking how much worse your health is than you think and where you're going if you don't make changes, and reminders and updates and saying, hey, this was this today and this was this today and you had this metric of health, and all these things that they can basically say, hey, you're not heading towards a good direction right now. You are going to get sick and maybe end up in the hospital. But you don't know that right now because you haven't been tracking it. So yes, you get sick, you go to the hospital, you're like, oh, I got sick. Time to now finally take a look at my health, see what I need to do, maybe get a medication, and then move on from there. But what you don't understand is you were tracking that way far before that even happened. This isn't just oh, I need a medication, time to move on from life scenario. This is hey, this is step 1 and maybe a step 12 process where you're going to end up incredibly ill, injured, hurt if you don't make a change right now.
Yes.
But how do we measure that? And how do we push people in the direction that actually pushes them onward from getting down and hurt and ill? But yeah, that's what I think is going to be the most exciting when using this model, as it updates you in real time and you get to be able to track that over a time series of data.
And then to put that into context, so it may hit more for some people than others, but think about the trajectory of maybe like your testosterone is normal, but is declining like 8% every year. What is the trajectory?
Yep.
Maybe, let's say, for example, your A1C, blood, your fasting glucose is rising every year. Okay, is it normal now? Awesome. But if it rises every year, okay, where are we at diabetes-wise eventually? Yes. And it's the trends, the trajectory, the ongoing maintenance of the body. And fascinating enough, we talk to patients all the time, and we ask them, when was the last time you had blood work? Oh, I don't even remember last time when. That's such a common phrase. Or maybe a few years ago. That is very concerning. That's a big thing that you definitely need to start paying attention to, you and your loved ones, and start collecting the data on a monthly, yearly, biannually trajectory duration. Because the more information that you're going to soon find out and the more data you're collecting is going to have so much better implications in 10, 20, 30 years from now.
Beautiful. Information is power right now.
Yes.
And with these technology coming out, that's really where you can start to play around and get better information using that data. And so that was a really good point, because when, for example, this is a Stanford study, it showed deep molecular tracking of individuals long term. And they tracked genomics, proteomics, metabolomics, microbiome, and then they were correlating it with illness, resistance in insulin, their other inflammatory flares. And what they ended up finding was that disease signals emerged months to even years before diagnosis. And individual baselines were far more predictive than norms. So even though some of these patients may felt normal, or they were thinking that they were maybe healthier than they were, but what was happening over time is something that maybe wasn't getting caught by the provider, because maybe labs were relatively normal and maybe they weren't bringing up anything that was of dire concern, like of red flag symptoms.
They have so many patients to see in a day, they have to pretty much get the fire under control with that person right then and there instead of looking at the whole timeline.
Yep. But this study was literal proof that digital twins is needed for the best prediction of health over time.
Yes.
And it's not so static anymore. It needs to be this dynamic, ongoing live tracking at all times to really be able to pick things out before they happen. Imagine being able to start shifting people away from getting cancer long term because of this data, shifting away from having heart attacks and strokes and everything else that's going on, that we're having such large amounts of diabetes, all the other things. That's really where, if this data existed in conglomeration to this technology, how many things can we stop from happening in the loved ones that we have, family, friends? I can assure you, if you're not listening now, that hopefully your ears just perked up, because that's where I really want health to. That's how I'm building what I'm building. It's the reason why I put so much time and effort into this kind of sector of health, because I think it's going to change. It's going to change the world.
Everything's moving in this direction.
Yeah.
It's moving very fast.
It is
with
moving
AI.
fast.
You take a snapshot. If you're living under a rock or in a remote area, you come back. If you're out there for 3 years, you come back and it's a completely different world.
Yeah, and
to say the least.
even on, like, for example, I know you've seen this too, Doc, but like on our Whoop bands, it actually tries to predict how fast you're aging based off of all the metrics that it has. And so this is another kind of concept that we can talk about, which is AI doesn't panic over bad numbers per se if it's just a one-time shot of information, but it will panic over acceleratory changes that are happening quicker than they want it to, and we can see rapid progression or even a little bit faster than normal progression. And on our Whoop bands, we can see at what pace of aging are you aging? Are you aging faster than normal? Are you aging slower than normal? At one point in time, I think I was aging, my biological age was 2 years younger than my chronological age. So I had basically been outpacing my aging by about 2 years because of how I was treating myself. And that information just shows that what you're doing long term does make a difference to the cellular changes of your body. I know Ben Greenfield shared, I think his was like 6 or 8 years younger.
Wow.
He impressive.
Looks like
impressive.
That too.
I think he's in his 40s now, but he was aging like he's biologically in his 30s still, or something like that.
I can see that.
But I imagine if you still felt like you were 30 in your 40s or 50s. I know people want that.
Yes.
Don't deny that's something you're looking for. But how do we get you there? We need to track. We need to figure out ways to turn the dials to know what to do, to how to help you, and that's really what we're talking about today.
Data.
Yes.
Another good example is, let's say, frozen shoulder or adhesive capsulitis. If you're usually comes in older ages, and there's a correlation between the thyroid and autoimmune condition with the frozen shoulder that we just can't explain just yet. But let's say, for example, you're maybe in your 50s, 70s, you got a shoulder injury, and you're trying to rehab it, but it's prolonging. If you're not paying attention to that, prolonging can turn into the frozen shoulder, but can you catch it soon enough? If you got injured, are you able to rehab specifically for certain tissues to prevent that process to come into play? So and that's just one small example that the trajectory and knowing the trajectory long term maybe could prevent it from even having the injury in the first place to then rehabbing to the frozen shoulder. So there's a progressive steps, but that's where we have to get the compensations under control and learn your body so you can understand the data that can come with it as well.
For sure.
Essentially.
And I think there are a lot of metrics that are helpful to track. I'll give you in case of obesity as one. That people maybe, if you're still trying to figure out how this may work with your case, obesity, there are so many markers that predict obesity or worsening obesity. And one of them is insulin resistance, we know that. But what we don't understand, what some people don't understand, disrupted sleep is a huge driver of insulin resistance. So just in this one case study alone, if you don't sleep very well and maybe you've been tracking your sleep and it's just not improving, that's important because over time it can develop insulin resistance, thus making it harder for you to lose weight, even maybe putting on weight. And that's really where that just one kind of flow makes a huge difference from this standpoint. Not even tracking your pounds on the scale. We're going all the way back from how did the pounds get there.
Yes.
Disrupted sleep is really the metric we should be tracking, not the scale. Because I think people are getting those confused. What are some other things, different blood markers that are changing over time? Even like you just mentioned, hemoglobin A1C, fasting insulin, fasting glucose. There are other metabolic drivers like AMPK and other blood pathways that maybe we could be tracking too. That's a little bit more deep in dive, but there's also showing changes in the microbiome with obesity. There's showing genetic factors that maybe we can look at. All of these things can we actually put on a digital framework and understand what's the biggest driver of your obesity, what do we need to do to shift that, and what are some things you can do right now to make a difference. Trust me, that's what's going to take care of this obesity epidemic. It's not going to be what calorie different, macro, all this stuff. It's just, we're not quite getting the big picture yet. But I hope this definitely paints that picture for us long term to make these kinds of changes.
Yeah, it's so many small snapshots within the art gallery, essentially.
Yes. And if you're struggling, it's why isn't my weight, why am I losing weight? Yeah. I know so many people out there that are struggling. And it's, maybe I just need a GLP. And it can help short term, but how do we get there long term?
Exactly.
And what aren't you tracking? What are you missing? Yeah, I think it's really helpful to recognize these patterns. This next study also just showed the same thing, but this was done at Google Health AI. It was a longitudinal study showing changes over time, but what it was trying to show was, can clinicians predict the changes that are happening in patients versus these AI softwares, and how much more accurate and or quick is the prediction happening. So you did a great job explaining that we're very snapshot native. Doctors can be very snapshot native to patients here. What are we looking at right now? Okay, this happened recently. Okay, let's make this change. Okay, we'll see you in a few months. Versus, all right, what are we looking at the last how many years? What's changed over that time? What are we about to get into? What has happened and what is going to happen if you don't make a change? That's the healthcare model that needs to be changed right there.
And that goes back to questions that you would go into the doctor's office. This is what I've noticed from previous years since I was younger to where I'm at now. What do you predict based on the trajectory or something thereof?
Yes. And what it basically showed was the ability for AI to catch these issues was, again, months to even years quicker than some doctors could. And that's scary because it sucks that we don't have that capacity cognitively to do that. Maybe very few, if any, do as a provider to the level of AI that it can. But AI excels at network thinking. It can basically, we don't quite have the ability to think of multiple things at once and then bring them all together at the same time. We have to switch between thoughts because we can't think of all of these things at once. And so AI doesn't have that barrier. It can think separately at separate times using all this information into one. And that's really just, it's like an orchestra. And its ability to read everything all at once, it excels at that. And we shouldn't be threatened by that. Instead, we should say, man, how can we use that to help people's lives? And that's really where I think healthcare is going to go, and it should go.
Such a smart point. Because AI, they can't necessarily read too much off your emotions, or it doesn't have that intellectual connection from a human to human as it does to a machine to human. It may project past trends based on speech, demeanor that you give it per se, but at the same time, that's also where I think that from a human to human connection, that's going to trump, especially from decision making with the use of AI, to give us more understanding. Because let's say, for example, we have all the information, but someone's emotionally going through something or a situation at that time. Yes, AI might be able to read it, but can you react and address that individual in a human-to-human way to help them move along in their journey? And that's where humans will come into connection. So like physicians, some may be scared, cautious because of AI, but if you are smart and intelligent and have enough emotional intelligence, you're going to be winning at the end of the day with using this as a resource.
For sure.
Yeah.
So Doc, one of the individuals that we had on the podcast, Micah, he created a company that is currently building a digital framework of human metabolism, among other things. He is also getting into genomics, proteomics, all these other things. The microbiome, I know, was another one of his, but he's basically mapping the digital framework for the human metabolism for using all of those structures. And so if you're thinking out there, like, how is this going to start getting applied for myself, and what does that look like? Doc, what were some of the things that you took away when Micah was talking about tracking the metabolism and some of the markers that they were obviously talking about? And what is Theorum, which is his company, looking like maybe in the next 5 to 10 years?
Yeah. Essentially, from that episode, it changed my mental thinking and trajectory of where the healthcare system will eventually go, which is also why we're bringing this up today, of how can something as complex as the human body be broken down, understood, and put into a database. And not only each person is so different from one another on a cellular level, on a gut microbiome. So understanding the slight subtleties and slight differences is mind-blowing. People can't necessarily fathom that. It's even hard to even put that into context, essentially. But having that framework is incredibly important. And you even think about how this even got started. It started with, I believe it was, jet engines?
As for the technology.
Yeah, they replicated that, and then they thought, can you do something very similar, but with the human body, obviously. The complexities involved.
Basically, the digital twin of the entire complex airplane system, and then they'd run simulations on it to see what could happen over time to the system, if wind or change or all that stuff. And then I guess someone stole it, and now they're making. I'm sure they're gonna do that with others. It's just systems.
Yes.
It's a system tracker. Whether it's a robot or whether it's a human, what kind of ways can you track it over time, live time, and give you updates on?
Yes.
Yep.
I'm assuming Google's doing the same thing through social media, other AI companies. Like, the whole landscape is going to change based on data and centers, essentially.
What I would see or foresee is you're going to get so much more specific subtypes of patients to research. So what I mean by that is, let's say, for example, this is what happens, is some patients respond in the study, some don't.
Yes.
Right? I would say that's pretty common.
Yeah.
80% saw this improvement and 20% didn't, or 50% some didn't. What we can try to figure out is what genomic subtype did this patient have versus this patient, or let's say we only want this genomic subtype, this microbiome subtype, this proteomic subtype, and that's the only patient we're going to study compared to control, or maybe compared to some differences. And then what was the actual outcome from that? And it's no, okay, patients with this genomic subtype, this microbiome subtype responded the best to this modality or treatment. Okay, perfect. Now, as we're tracking these in humans, we know, okay, patient this subtype, you will respond best to this modality. Sorry, patient subtype this. Unfortunately, you're not going to be as high responder. Instead, we've actually found this is what's going to work best for you. What does that mean in real time? It means this patient may respond better to this supplement, this drug, this modality, or not.
Food.
And now, food, exactly.
Yeah, like anything.
And we can be so much more efficient in actually gaining outcomes for each person, not getting all right, there's 50 of you in a room, 50 of you try this, 25 of you did better, 25 didn't. What are we going to do with the 25 that didn't? Sorry, you didn't respond. How much more effective and accurate can we become?
And then you're jumping around from clinic to clinic, physician to physician. You're stuck in the loop.
Yep.
It takes that completely out and be extremely specific for each person. And even when, Doc, you said the archetype, that is, with the gut archetype, there is so many more layers below just that subtype. Like, I almost want to say infinity back down, but
trillions of different microbiota in the gut. So do we have a lot to research there? Yeah, we do.
Yes. So a lot of it comes back to specifics, but that then you can start seeing how the trends of managing one's system and body are starting to play a part into the trajectory of the healthcare system.
Yeah.
It might come sooner than people realize.
So Doc, have you ever played around with your own data in kind of what I would say similar to maybe what these companies are doing, but have you ever taken or put a conglomerate of your own information into AI, even small or large, and then started to help use it, track it, something like that nature? I know you've said you've kind of similarly played around with that. How much of the information have you given?
Yeah, some of it was some lab work in the past, and added that up with, and I was curious too. It was like past lab scores. It was like a dental exam that I had that didn't have too much depth to it, and then it was like a physical. And then a range of motion exam when I was going to chiropractic school. So I put a bunch of things together, and it was fascinating enough that before it spit out information, it asked me questions. For some of these, how long did this happen? Or how long ago did this happen? And a few more, if I remember right, specifics related to the scans. And then it spit out everything else and gave me almost a scary snapshot of this is the, not trend, this is what was going on. This is what you may want to pay attention to in terms of potential disease or risk factors.
Sure.
I didn't ask it more questions to go in depth of how does this look long-term trend trajectory-wise. But knowing and having that, I'm definitely going to utilize that long-term from there. Which kind of gets us into a little bit of the next point of how can you start collecting your own data and how can that follow you from year to year, decade to decade. And now as we were talking prior to the podcast, as certain AI systems are evolving and improving, there's only so many, and right now with AI like ChatGPT, there's only 10 file links that you can add to a chat at each time, and it's going to take you forever. If you can put everything on one document and go as in depth as possible, maybe that document is 1,000, 10,000 pages long. It's in one spot. Obviously, you probably want to have backup drive, I would assume, or your family, or if you have kids, start this for them. It is going to be worth its weight in gold long term. I was this year old, I had this go on, maybe a loss of teeth, and maybe I had chicken pox, maybe a small little context related to that. And then are you able to go year by year to add and start creating your database, but it's all in one spot? I think that's going to be so important. Can you add blood work into it? Can you add other scans, genomics into it, x-ray scans, MRI scans, eating patterns, maybe emotional health, married to a significant other this date? Like, you can probably put essentially your whole life in there. So then it gets the mental, slight, if you go in depth enough, emotional part of it, physical, the chemistry, it has everything. So it has all the information to sift through, thus to give you your trends long term and maintenance thereof.
I've used it for pattern recognition and blood work.
Great.
So I've given it 5 or 6 years worth of blood work, and it has picked out trends over the years and things to think about, reasons why, those kind of things. And it was really helpful. I've also used it for, over time, seeing changes in like workout recovery schedule, that kind of thing, helpful. And then I'll feed it my Whoop data here and then. That also gives it data to help. But like you said, you can only feed it so many reports. That's where unfortunately you're limited. I don't know if any other AI software engine has limitations, but I would hope that's going to be a barrier that it can be somewhere along the way. We can have changes where we can just keep our own digital twin up, and as we keep feeding it data, it just then continues to collect information. And then that's where you have the ability to say, I'm curious if I should take turmeric. Do you think my body would respond? What do you think? Or have it just keep putting out information as far as what it thinks you need to be doing differently, what do you need to be taking, all these other things. And again, the amount of impact on your health that's going to have is going to be far greater than any other information that you can gain.
It's worth its weight in gold.
Like it's going to be just crazy.
Yeah, we're so early into this, and the fact that if you start creating this early on, even right now, once those systems come into play, you're going to be able to utilize past, obviously present at that time, and then help you future. But if you don't have a past, it's just going to go from present to guessing to the future with what you know right now. And maybe based on your memory that you've recognized in the past. that is the worth its weight in the gold. That's going to be something strongly recommended for anyone.
Yeah. And so if you guys are interested in at least getting started, take a look at Micah's company. It's called Theum. It's Therio, Therio.me is the website. And you start out with a blood kit, and it gets you get sent a vast report, I think close to 100 pages of information. And it breaks down, at least this is when I did it. It might be different now. I know they've been making changes over time, but it broke down each system of my body into grading scales based off of all of the hundreds or thousands of different markers that it was testing. And then they had a provider jump on and help me dissect what each of those meant. And then it had the digital twin report at the end that basically they ran 1,000 simulations of all of the modalities that they have in their database for what I should be taking as far as supplements, changes of exercise, sleep pattern, diet, everything else. And it was customized to me. And in my opinion, that's the farthest anyone has gotten when it comes to the digital twin was this I've ever seen.
Wow. Do you still utilize the information from that scan?
Still, to this day, I take the supplements that it told me that I should be taking. It changed. It already said I should be an intermittent faster, which I already was. So that was cool that it said that my body type was like perfect for that.
Wow.
It also stated that I should be doing this amount of exercise per week, which is I think was like 3 to 4. And then it said that, so I'm curious how it'll change over time, but I provided information to the provider about my family history of health. And so he, even though he looked at the markers and he was like, I don't see anything yet, he still recommended that I should take this certain supplement. Basically, I have a family history of methylation issues, NTHFR gene expression. I haven't been tested for it, but my family members have. And so even though you haven't been tested, I still think a methylated vitamin, methylated B12 or something like that, maybe not a bad idea. Then the one that popped up the most for me was taurine. Apparently I just was, even though I eat a lot of meat and those kind of things, there was not a lot of bioavailability in my body for it. So he said I should get on a taurine supplement, which I've been taking. And then there were a couple other things that had been mentioned. A fruit and greens powder. I guess just microcellularly, I wasn't getting a lot of those micronutrients. And so a fruit and greens powder was a big one. And then fiber, a lot more fiber, which is interesting because I feel like I eat a pretty good amount of fiber, but he said that most people underdose fiber. Wow. Very common. And I have a family history of colon cancer. So fiber is a huge help to reduce the risk of colon cancer.
Especially for the gut microbiome, makes sense.
And they're recommending like 30 grams of fiber a day, which your fiber supplement is only about 2 to 5 grams.
Oh, good Lord.
So if you think about it, if you're just going to try supplements of fiber alone, you'd have to do it 4 to 6 times a day. So you want to be getting it from cruciferous vegetables, from root vegetables, from sweet potatoes, things like that. That's where, and it makes sense with the fruit and greens powder because I tend to not eat a lot of those.
Wow.
So yeah.
That's beautiful, man.
Incredible amount of information. I loved it. I can't wait for them to continue to develop, build, just make it so much more powerful. It's already a great resource for you to check into your current existence and health.
And not just to pump the tires either. Micah was very honest, upfront, intelligent individual. How was it working with the team and asking questions?
They were great. They were awesome. They broke down there were, I want to say, hundreds of markers.
Wow.
We had to pick the ones that, because you have to do a questionnaire prior.
Okay.
And the questionnaire is also helpful to help point, because again, you can't treat every marker the same. You want to try to make sure you're efficient with what markers maybe are tying into the symptoms or the things you're dealing with the questionnaire.
In context.
Because you want to, that'll tie it, make it more personal. But yeah, they picked out the things that I had said. They were talking about those, but obviously I had a pretty high, relatively high score. There weren't many things that were concerning other than just a few, which maybe feel pretty good that I wasn't progressing worse than I had already originally thought. But
fascinating.
Yeah, I'm curious about what other people see as far as their scores and how that tied into their health over time and how they got there and those kind of things.
Love that. The thing that came top of my mind, and this is left field related to the blood work and some of the stuff from Theorum, but even understanding your musculoskeletal health and your joint health, even recording videos of movement screens, tracking a thermometer of how your grip strength is, long term, how's your internal rotation of all your major joints, shoulder, hip, knee, and paying attention to that on a quarterly, biannually, yearly basis to see your trends as well. If you have images, MRI, X-ray, that also help quite a bit in terms of joint space, so you can have an understanding there. But that's another one that can help prevent arthritis and degenerative changes long term.
I'm already seeing companies in my areas where I like to study, which is neurology, AI videos that are already picking out abnormal gait patterns before neurological disease starts to happen. Yeah, it's incredible.
Interesting.
So they basically are using AI video trackers in people's homes, and they're tracking how they're looking like they're moving day to day. And some of these elderly, it actually is also, it's predicting falls before they happen.
Wow.
Based off of the gait patterns that they're presenting with, predicting neurological deficits, even just other changes you wouldn't even expect, health issues, all just from tracking their gait. And then it analyzes it, puts it on a graph, and then you can study the graphs, and without even seeing what the person looks like, you can use the graph to understand how they're walking without even having to see. Dr. Ted Carrick actually was brought into, he was the one that I was explaining this company, but he is such a savant when it comes to neurological issues. And they gave him a graph of someone who had Parkinson's, but they didn't tell him he had it. But just by the graph alone, he goes, that person has Parkinson's.
Wow.
And they're like, how do you know that? And he goes, I can time what their gait looks like based off of the graph. But he did it himself. He already knew. He was so smart, he could just do that. But other providers, if you got taught how to read graphs and how to understand the delay of the swing versus the stance phase and all those changes that happens, steppage usually, that's where you're going to see an issue.
Even brain scans too, getting those. Wow.
Yep.
There's just so much. And that might go back to a potential, not say we're going to debate on here right now, but of the privacy issue of AI.
Oh yeah.
Obviously, that's
going to be a huge issue.
Yeah. But if you take the privacy out of it, if it can help your life with being, privacy is going to be probably the best thing to say on this one. But if you can have the technology but still keeping the privacy, it's a win-win all around.
It is, for sure. And I would hope that the companies that are creating and using this information and technology are having integrity and protecting it. Micah mentioned that they will never, ever sell your data. And not many companies that are in that space have that. 23andMe was bought out by GlaxoSmithKline. So now that amount of information just went to that pharmaceutical conglomerate, unfortunately. And I think you're going to see still an issue with some of those companies who are going to sell your data. But
trust.
I think, again, just working with companies that have that integrity, protect your information, is if you have a concern about that, just make sure to look into that. But with AI, yeah, I would hope that there's going to be some barriers put in place, but I think it's still an issue of concern, and they're still trying to create those regulations.
Yeah. So I think the big takeaway from today is look at your health, trajectory long-term, past, present, future. Start collecting data information in the past, compile it all in one area, document, and take that with you and continue adding on to it as the new health care system starts to evolve into something that you may not recognize, and it's coming soon enough.
It is. Let us know how it went for you. Let us know if you have any information that you've been tracking, interesting stuff with obviously AI or other companies, maybe bloodwork companies, anything like that. We are always interested in wanting to learn. So as always, guys, please share and subscribe. We hope each and every one of you have a great day. Until next time, we'll see you later.
Disclaimer, the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the functional code. Until next time, stay well, stay informed, and embrace the science of living well.